Hello, everybody. This is Andrew Cosman, physiotherapist with ADM Ottawa Physiotherapy. Today, we continue our series that we started last time about hip pain. Last time, we talked a little bit about the anatomy and the function of the hip. And today, we're going to talk a little bit about the common causes of hip pain. So, we're going to talk about three. It's not a comprehensive list. There's a lot more causes of hip pain, but three of the most common are the following. So, the first on the list here is osteoarthritis. A lot of people, as they age, will develop osteoarthritis in different areas of the body, and it's usually associated with being part of this, the golden years and the elderly population. However, I think it's better thought of as a wear and tear kind of kind of injury or kind of pain, because over time, yes, there's a lot of wear and tear that goes on, but so does it happen with younger people who are more active. There's also potential genetic predispositions that exist. And depending on the person, if they have previous injuries to that area and the area doesn't work as well or as efficiently as it once did, then again, the wear and tear can increase. So it's not only something that exists in older populations, but it is something that can develop in younger populations as well. So the first one there is osteoarthritis. The second one around the hip is bursitis, and we'll combine with it the tendinitis. Nowadays, we tend to think of them as one thing, not that there are not two different structures. The bursa being a kind of fluid-filled sac that protects certain structures against each other. It acts as a bit of a cushion, and then the tendon is what takes the muscle and connects it to the bone. So you can have different irritations in those structures, but because they're so intertwined, the treatment of them often and the diagnosis of it often looks very similar. So this tends to happen in younger people because like a tendon that might get overused with different sorts of activities, but it also gets irritated with different sorts of pressures that gets put on the tendon. So, for example, if somebody is a side sleeper, and whatever the combination is of their mattress, their anatomy, and so on, there could be a little bit more pressure put on the tendon. So that could be a cause of irritation. People who cross their legs are at an increased risk of irritating the tendon around one of the tendons anyway around their hip. So this irritation, as the itis would indicate, inflammation, irritation, in my mind are synonymous in how I use it to explain to people. Hip bursitis and tendinitis are the second thing on the list of common injuries around the hip. So now the third one may be less intuitive, is the lower back as being a source of hip pain, because the lower back is the source of a lot of nerves, and those nerves run down our leg all the way down to our toes. So any irritation to the nerves that exist in our lower back has the potential to cause pain in our hips. So that's where a thorough diagnosis or a thorough evaluation needs to take place for the diagnosis to be made of where is this hip pain actually coming from. From the very beginning of our schooling as physiotherapists, we're often taught to examine or screen the back for any problem that might go into the leg, just as we are taught to screen the neck for any problem that might come to the arm, just because the nerves that exist in the neck and in the lower back have that potential of causing pain in the hip and the rest of the leg. So, just a quick recap: osteoarthritis as number one, hip bursitis and tendinitis as number two, and the lower back as another potential source and cause of hip pain. So stay tuned till we continue our series next time. Bye for now.